Hi, my name is Jacy.
Hey, my name is Juan. Welcome to The Couch, a podcast where real therapists talk about real things.
Please remember that while we are therapists, we are not your therapists, and this podcast is intended for educational purposes only.
Educational purposes only. Feels like the more we jump into life, JC, the more of these disclaimers are out there.
Honestly, I feel like it's kind of necessary though, because people kind of take what they hear at face value, and we want you guys to listen to us, but we're also encouraging you to branch out, ask other people, and, you know, get information wherever you need it from.
That's right. Do you do this in your sessions? There's times where I'll share with somebody and I'll say, I'm gonna share some things, but I want you to remember I'm not an expert and I don't know everything. And there could be somebody else in this chair sharing something very differently with you. I want you to take it and utilize it in a way that you think makes sense.
Yes, I have
Yeah.
absolutely done that before, especially if it's like something additionally that I'm not so sure about.
Hmm.
Yeah, happily, I'll be like, hey, you should probably go check in with others because I know a whole lot of things, but I don't know everything. So take that as you will.
Yeah. I think there's like a good humility in it, a
Hmm.
humbleness, and then an acceptance of we're all we're all on this journey of life,
Hmm.
trying to make it work and trying to figure out what's, 10 steps ahead of us, knowing what we know now.
Hmm. I think it's just like we have very specific knowledge in certain areas and spaces. Like I know that you have been like a soccer coach in the past, so like you have a lot of knowledge about how soccer works. I don't.
Goal.
Like I only played soccer for a couple of months when I was like 11. So I can't even say that I have that knowledge, but when we can defer to each other, learn from one another and be open to what everybody has to say, I think we come out like better for it.
Yeah, I certainly agree with that. And maybe that kind of bridges us into our topic for today, which we were talking about it before the episode. And I'm glad that you presented this topic on getting to know all of the different titles and professions in mental health, because there's a lot of them. And
Hmm.
as a practitioner in the field, I get confused sometimes by how many there are.
For sure. And, different people do different things, different folk do the same things.
Hmm.
And for people that are looking to start their journey on their mental health care, they may not know who they're looking for or who they should be talking to. Do I need a psychiatrist or do I need a therapist? Do I want to see a social worker or do I need like peer support? And the
Yeah.
list goes on and on. So in today's episode, we're going to
Hmm.
kind of help the community figure
Yeah.
out who's who. And honestly, we might be speaking to some professionals too who just don't know just how varied the mental health field is out there.
Yeah. So it's nice because as a person out there that needs help, you could
Hmm.
listen in and go, okay, so this is what a psychologist is, or this is why I would go to a social worker versus a licensed counselor.
Hmm.
And I think I'm going to learn some things in here because I know that I know that culturally, like if I go back into my childhood in Dominican Republic, there, from what I remember, there's not a lot of all these terms. Mostly
Hmm.
we would in our community just say, are you going to the psicólogo? Are you going to the psychologist? But that was it. It wasn't
Hmm.
many of these other branches that we have here in the US.
Yeah, definitely. I know that it was all just kind of lumped in as the doctor. Like for a lot of like Southerners, especially, I grew up in a super rural space. So
Hmm.
everything was just the
The
doctor. It
doctor.
didn't matter who you were going to. You're going to the dentist. Oh, yeah, I'm going to the doctor. You're
Yep.
seeing your therapist. Yeah, I'm going to the doctor. Your dermatologist. Oh, yeah, I'm going to the doctor.
Hmm.
It didn't matter who
Yeah,
it
yeah,
was. So having some specificity will help you get closer to your goals if you know exactly who it is you're supposed to be talking to.
yeah. There's I forget what movie this was. Was it like the Magnificent Seven or the Something Seven? It had Adam Sandler in it, I think.
I
And it's
somehow
like,
feel like you're correct, but I have Google right in front of me, so we can figure it out.
yeah, it's like him and like seven other people in a cowboy kind of movie. I wish I could remember it.
You
And
are indeed correct, but I don't see Adam
oh,
Sandler. Continue.
here you go, the ridiculous seven. No, the ridiculous six. The
Oh,
ridiculous six.
okay.
Yeah, so there's like this funny scene where I think they go see their barber, and the barber gives them, I don't know, this paste that the
Mm-hmm.
doctor also gives them, that the dentist also gives them. Uh, but I could be butchering it. But the point of
Mm-hmm.
that is you have your comment of like, who are you going to see the doctor? But it's like this consistent person, maybe. Uh,
Absolutely.
it's definitely funny in my head. It may not be coming
Mm-hmm.
out funny.
Honestly, I trust you. I trust that it
Thank
is
you.
something
Thank you.
funny. But let's talk about some common things that you'll hear when we're talking about mental health specifically. So, if you've ever looked for a therapist, or if you've even just typed in mental health resources near me, you might hear words like clinical, professional, graduate, qualified, and all of those words have to do with somebody's level of education.
Mhm.
So, for North Carolina, which is the state that we're in, we are licensed clinical mental health
That's a
counselors.
mouthful.
I happen to be a licensed clinical mental health counselor associate because I've
Mhm.
completed my graduate work, but there's a level of hours that I need to complete in order to be considered fully licensed. Whereas you go to a state like Virginia and you've got qualified professional counselors
Mhm.
or graduate professional counselors, which graduate means you've completed your schooling, but you haven't gotten your hours. Qualified means that you've gotten your hours and you kind of get to drop that associate status. And the difference between them is literally just clinical experience. But depending on what it is that you need to be seen for, you may need to seek somebody that's got that different level of expression.
Yeah.
And like just to I gave out my credentials. What are your credentials?
Yeah, very, very similar. And I'll go back. It's interesting. Way back when I was in school, I didn't think about these credentials and this field in the same way that I wish I would have known now, because it gives you a little more depth
Mm-hmm.
to understand how you can help and serve someone.
Mm-hmm.
My credentials, the first one is my CRC. And a lot of
Mm-hmm.
people aren't familiar with the CRC, so that's a Certified Rehabilitation Counselor. I'm a WSSU grad, so go Rams in Winston-Salem. That focuses on disability, a lot on
Mm-hmm.
helping individuals in the workforce to be able to recuperate and jump
Mm-hmm.
back into society, if you will. That that there helped me to go into my clinical licensure, which years ago, maybe like what, 3 or 4 years ago or less than that, was the
Mm-hmm.
LPC. So that
Yeah.
was a licensed professional counselor.
Mm-hmm.
Now, similar to JC's, a licensed clinical mental health counselor.
Mm-hmm.
With that, there's different levels, all the way from associate to where you get a full license, and then you can get a qualified supervisor, which I'm not sure if that's a thing anymore.
I think it's just supervisor now.
It's just supervisor, yeah.
Yeah.
There used to be a qualified supervisor, which would be that you've worked a little bit longer in the field and you can start
Mm-hmm.
supervising individuals. And then there was like a full supervisor, which I have that now, that you can supervise associates, so newly graduated clinicians during their first normal 2 to 3 years. Um,
Yeah.
and and then I have my doctor, but that's not really a license. So
Mm-hmm.
yeah,
But it's
well,
a credential nonetheless. Like it does influence your work. So,
correct, yeah. So my doctorate's in counselor education and supervision, and what
mm-hmm.
that means in the world of mental health is it allows me to go into research. It allows me to teach at a graduate level,
Mm-hmm.
and then have a little more knowledge on topics of like theories and ethics or culture, all the common mental health ones.
Which it may
Boring.
not be. It's like, honestly, it's not boring. It's really interesting if that's like what you're into. And you're right in the way that that may not influence the way your clients interact with you, but it
Mhm.
definitely changes the way that you approach your like
Mhm.
clinical practice. So when you're out and you're looking at all of these different types of license, which I'll kind of like step back and take that word clinical and remember our social work, like our social work
Yeah.
homies, licensed clinical social workers who are
Yeah.
also counselors in their own right, just with a
Yes.
little bit of a different education and different emphasis on populations than
Yep.
maybe your LCMHCs might
Hmm.
have. They do very similar things to what we
Yes.
do.
Yeah.
Honestly, we do the exact same thing, just with different license, different
Hmm.
board, different code of ethics. It doesn't
Yeah.
make us any more or less ethical. We're just different. So when you're looking for a therapist, it's important to do a little bit of your own research and see
Hmm.
who would fit the best for you. Like
Yeah.
Google these things, look at these words, and kind
Yeah.
of like figure out what's going to be a better fit for you.
Absolutely. And it can be, confusing there. I think sometimes it's helpful to look at them as an umbrella, and then the
Hmm.
umbrella is mental health professionals that can help me.
Hmm.
And then within the umbrella, you have like these little branches, if you will. There's little nods on the umbrella, but they can all help with keeping that rain out, right? So the rain is addressing mental health. The psychiatrists, I think that's a very common one in society of I can go to this
Hmm.
professional for medication support.
Yeah.
There are still some psychiatrists out there that will do a long therapy session, what you and I just
Yeah.
see as like a standard 50-minute session to 60 minutes.
Hmm.
I would say a good amount of the others lean more towards somewhere around a 15-minute
Hmm.
session where they check in with you on how you're doing with your medication. And then they'll cross reference or cross analyze in some way the work that you're doing with the counselor or other mental health professional that does uh, the talk therapy. So I think that's a
Hmm.
popular word that may ring
Yeah.
a bell for individuals.
For sure. And also, psychiatrists are med school graduates. So
Yes.
they have gone through all of the training that maybe a general surgeon has gone through,
Yep.
and they just chose to specialize in psychiatry. So you might find some psychiatrists that do provide sessions. It's way less common now than it used to be,
Yes.
with the advent of psychologists who kind of fill in that gap. They are also doctorate level clinicians. They just didn't go to med school. They instead have something called a PsyD,
Hmm.
which, if I remember correctly, is a psychological doctorate
I
or a
believe so. Yep.
psychology doctorate. They typically are the people that you'll see for assessments. So
Hmm.
if you need to be assessed for ADHD or autism or a learning disability, developmental
Hmm.
disabilities, you'll see a psychologist, and some
Hmm.
psychologists also counsel, and that's a little more common. They just don't
Yes.
prescribe medication.
Correct. Now, to make things a little more complicated, I believe there are some states where psychologists do provide medication. And is it
Hmm.
Texas or
I'm going to be so real with you. Texas is a little bit lawless, just a
okay.
little lawless. They are one of the most difficult states to be licensed in for
Yeah.
psychology and being a counselor. But they have some of the more individual based ethics.
Mm-hmm.
So in Texas, the client's right to privacy supersedes some departments of mandatory reporting, in case you didn't know.
Mm.
Um, yeah, that right to privacy is real strong in Texas, and I do believe that they are one of the states in which psychiatrists can prescribe medication.
Okay. And if I'm wrong, scratch that, pretend you didn't hear it. That was a guess there. I felt that I was talking to a colleague about this, and they mentioned multiple states, but I haven't done the reference check to actually verify. And I bring this topic of gray more from the aspect of you have, as JC was mentioning, a psychologist. So if you have a child, let's say that you may think that, I think there's some autism here, or I think there's some ADHD, attention deficit hyperactive disorder. You could go to a psychologist that's trained in that category, and they would do
Mhm.
some assessments, aka some tests, lots of questions, this long report, and it'll come out and say some details on yes, there is a diagnosis or no, and then recommendations. What I'm
Mhm.
noticing now is there's more of a, which I think is positive in some ways, there's a growth in the social work and in the counselors. So I think this is important for the community to know where counselors and social workers are getting advanced education. So that's where they're
Hmm.
going back to school and getting a doctorate, or they're engaging in additional trainings that's helping them uh, take on these assessments too, very similar to assessments that psychologists are using.
Which is really fantastic because it provides additional access to the
Hmm.
community. Psychology or psychologists is one of those smaller pockets I find in the
Hmm.
mental health field where people are psychiatrists or they're counselors and nobody's really filling in that gap. So it just gets better access for our clients to be able to get the assessments that they need to truly get the help that they need. Also, I consulted Father Google, and the states in which psychologists can prescribe medication right now are Idaho, Illinois, Iowa, Louisiana, New Mexico, Colorado, and Utah. So, Texas, you're safe. No slander. So
Mm.
sorry. But those states specifically, psychologists can
Okay.
prescribe.
Interesting. Yeah, and this I think it's wonderful for the community in a lot of ways because they're getting, we as people in our community, we're getting more access to care versus just one provider. Um,
Hmm.
the providers that go into education, whether it's a social worker, a counselor, a psychologist, they're able to engage in more services.
Hmm.
If it's helpful, we can also touch on the continuing education component. So all of these that we're discussing, a psychiatrist, psychologist, correct me if I'm wrong, counselors, social workers, all have to keep their license up to date by
Hmm.
engaging in ongoing education that goes over ethics, culture, and then clinical aspects.
Yeah, and that is how we ensure that we're keeping our skills sharp. That is how we ensure that we're keeping up to date with new diagnoses, new medication, new treatment
Hmm.
plans, new theories that come out
Yeah.
because the field of mental health is changing all the time.
Yeah.
So in order for us to be acting ethically, we need to make sure that we're kind of keeping up and keeping on our toes because it's really easy to get
Yeah.
comfortable like, okay, I do this modality and that's all I do.
Hmm.
And for some people, that's really helpful.
Yeah.
But for most of us, we can all stand to keep learning and growing.
Hmm.
So as consumers, our clients have confidence in us that we're
Yes.
doing what we're supposed to do, learning, keeping it going, et
Yeah.
cetera, so forth.
Before we get into the header here of how can I tell who I need to seek help from, I want to touch on some of these other areas, like a school counselor. So that one, I think, in a way, is
Yeah.
self-explanatory. These are counselors, and it could be a school counselor, a school psychologist, a school social worker,
Hmm.
a school guidance counselor, which is more career-oriented, right? These
Yeah.
are all helping professionals in the school field. And often they'll engage actively with minors. And there's college level ones as well, college counselor or a clinical college counselor.
Hmm.
And then if for some reason the student is needing a different level of care or just somebody external, then they could see a counselor in the community.
Yeah, for sure. That's such a great shout out. We love our school counselors because they fill in a much needed gap that sometimes
Hmm.
we don't see because they get to see students in the school environment. They have a better
Yeah.
vision for like what the needs are, whether it's behavioral or if it's learning. So special shout out to y'all specifically because that is
And
not an
yeah,
easy job.
no, they're in the trenches.
They are in the
Yeah,
trenches. They see their kids for like 15 minutes at a time and they've got like 300
I
kids.
know. Yeah,
Like,
that's a caseload there.
listen, that's whew,
Mm.
shout out to them specifically. Um, but
With
we're
the
going back. Oh, sorry.
Yeah, no, you're
Continue.
good. Go ahead.
I bet. So, how can you tell who you need to seek help from, or how can you tell who's going to be the best fit for your needs? It literally depends on what it is that you need.
Yeah,
So, if you are seeking therapy for the first time ever, you're in your early 40s, you're like, I get really sad around the holidays, think I need to talk to somebody. who do I need to talk to?
Hmm.
Well, it may not be appropriate to talk to a psychiatrist because you may not need medication, and it may not be appropriate to talk to somebody who deals with like marriage and family counseling because maybe your marriage and your family are
Hmm.
fine. So it best practice can be to Google like what it is you're experiencing and then
Hmm.
stick the word counselor on the
Yeah,
back
yeah,
of it. So if it's like work-life balance counselor,
yeah,
you might come up with somebody who specializes in that thing, or, like ADHD counselor. You may find somebody that specializes in that thing, which you'd be surprised how minimal words can get you to what it is that you need.
yeah. No, good point. I was practicing this as you were doing it. And so I put in here what type of counselor can help me with my relationship. And
Hmm.
it popped in family therapist, professional counselor, social worker, pastoral counselor, psychologist, marriage and family therapist.
Hmm.
And then I put in what type of counselor can help with addiction, and it came up with substance abuse counselor, and then counselors that have some addiction background.
Hmm.
Yeah, so all of those are helpful avenues. I think as you're looking at which of these individuals can help too, be open to the process of learning and being informed as you go. So you may find yourself first working with a psychiatrist. It doesn't mean that that's a permanent place, or you work with a social worker. It doesn't mean that it's a permanent place. In that space, you can share what's happening, what your goals are, and what a lot of these professionals will do is they'll do what's called an intake. And an intake is where they get to know you, hear what's happening, and then they can give you some professional guidance as practitioners, whether, yes, we can do that here, or here's some additional spaces that may be more of an appropriate fit.
Yeah, absolutely. And I'll even add on to that. No, it's not permanent everywhere that you go, especially if the need itself changes and shifts, which it will. If you're
Hmm.
seeking counseling services, your needs are going to change because you're going to change as you gain more tools for your mental health. You may say, okay, I've got tools, but maybe this is still off. Perhaps I'll seek medication. Or
Yeah,
I've got medication under wraps. Maybe I need to see somebody who's a little more holistic to support me from
yeah,
the bottom up. And you can go so far as to specify what you need financially too. So low cost, no cost counseling near me, sliding scale counseling
yeah.
near me, student counselors
Hmm.
near me. You can go through your insurance portal even and select a counselor based on what the benefits are of your plan so that that alleviates the financial burden from things.
Yeah.
The best thing to remember is that there will be solutions that are accessible to you,
Hmm.
but it may take seeing somebody else to go get that resource.
Yeah. That's a good point. We didn't touch on levels of care,
Mm-hmm.
which we can highlight just a little bit of it because it's a deep rabbit hole. And when all these titles of a counselor, a psychiatrist, a clinical supervisor, etc., there's also some that go really towards that less clinical, holistic area, and that could be like
Mm-hmm.
peer support, or I think a common one people hear is a life coach.
Yeah.
So it goes back to you as the person, right, that's seeking the level of support and kind of
Mm-hmm.
thinking of what makes sense for me, and let me get into the space, ask questions, try it out, see if it makes sense. With levels of care, I quickly wanted to touch on that. You and I, JC, we work in outpatient therapy.
Mm-hmm.
So that's considered in the clinical space a lower level of care in respect to the severity of the needs of the patient.
Mm-hmm.
So let's say that if I am a patient and I am in need of medication management and I'm having um, active suicidal ideations, um, and I just need like a strong team around me. I'm going to go higher up in that level of care. JC, you want to share some examples of different types of higher up level of cares?
Yeah, of course. It can range everywhere from uh, being in a hospital setting. So oftentimes that is you will be in the hospital and you'll have a care team that will consist of nurses, psychiatrists, counselors, and you'll go through a process of being stabilized if you're having those active thoughts of suicide, or maybe you're experiencing some sort of disturbance of reality, such as hallucinations or psychosis. A hospital would be the place for that. Once you get out of the hospital, a lot of people transition into IOP, which is intensive outpatient, or PHP, which is partial hospitalization. Um, both of these are accessible to you and they expose you to more
Yeah.
therapeutic contact. So IOP might be like 3 days a week, four
Hmm.
hours at a time, and you'll be doing group therapy, individual therapy, and lots of other health supporting habits to help
Hmm.
you build a strong foundation so that once you transition out of that program, you'll come to us, which is outpatient, which is that kind of lowest level of care because
Hmm.
you need support consistently, but not as intensely.
Yeah.
So you can kind of say that the more intense the need for support is, the less time you spend
Hmm.
in those spaces. And not that's not to dismiss the work that's done in any
Correct.
of these spaces. It just depends on what the exact need is.
Yeah.
And we'll put a special pin in residential programs, people that handle substance use
Hmm.
issues, or people that are detoxing off of a substance, people who have needed higher levels of support for longer times,
Yep.
opt into those type of programs because you stay there for anywhere from 15 to 60 days,
Yeah.
depending on what the need is.
Correct. Yeah, I was just kind of thinking and listening as you were sharing. We had a lot of different who's who in the profession, titles, and my
Hmm.
mind's still going where there's a lot more that we probably could have spent time on. But I think we got the big picture of there's a lot of credentials out there, a lot of different
Hmm.
professionals that are able to help. And then B, the level of empowerment from the individual to take that first step, find one of those spaces, even if it's a quick Google search, and then try it out, see what happens, uncover,
Hmm.
some questions in that space.
Yeah, and never be afraid to ask questions either. Most of the people on this list, they'll offer consultations to you so that you can see if you're a goodness of fit for them. And if you find that someone's not a goodness of fit, I promise we will not take it personally, because
Hmm.
we just want you to get the care that you need. So you start working with me and you're like, hey, Jacy, this ain't working, champ. I'm like, that's perfectly fine. Let's make sure we find what's gonna work for you and
Yeah,
send you on your merry way.
perfect. Any last words, JC, before we jump off?
Um, no, not that I can think of. Oh, like just some quick special shout outs to our PMPs, which are psychiatric nurse practitioners. They can prescribe medication. LCAS, which are licensed clinical addiction
Hmm.
specialists. School counselors, we already shouted them out. Peer support specialists, who are people that have
Yes.
gone through treatment and support people going through treatment. Our community health workers, so harm reduction specialists
Hmm.
and folks that work in nonprofits for mental health. They are all a part
Haptex.
of our
Hmm.
community. Ooh, Habtex and one-on-ones, love
Yes.
them. Our occupational therapist homies,
Yes.
love them.
Hmm.
Like they're
Speech, PTs. Yep.
uh they're all people that are helping to support others, and we're very appreciative of them in all of their spaces.
Yes. Well, we appreciate y'all listening in to another episode of The Couch. We will catch you at the next one.
See you guys soon.